So welcome to the Jefferson County Department of Health panel discussion. I guess before we get started, I just kind of want to give you just a brief story of how we got here. Kayla, raise your hand, please. Wave it high. All right. Kayla is one of 4 brilliant young ladies that I supervise. And Kayla came to me one day and she said, you know, Melissa, I really want to go back to the School of Public Health and talk to the students about being a disease intervention specialist. She said, when I was a public health student, I wasn't very familiar with all of the different career opportunities that were available to me. And so I love what I do, and I want to make sure that people understand what we do, who we are, and what's available to them. And so that's a little bit about why we're here. This is Kayla's baby. She kind of created this. And so she drafted a proposal. She reached out to Sarah, your alumni affairs specialist, and here we are. And so I just appreciate everyone who's been in the process to kind of help get us here. So we're excited to share with you all. And so our goal today is really to kind of introduce to you all 2 different epi-related career options: disease intervention specialist and epidemiological analyst, okay? And so we want to talk to you all a little bit about our background, because there's no one way to get to a certain career field in public health. All of our journeys have been different, and we want to highlight that. We also want to describe for you all what a typical day is like for us in the role of a disease intervention specialist and in the role of an epidemiological analyst. So without further delay, I will turn it over to our first speaker, Ms. Felicia Velvet.
Thank you. Thank you, Melissa. So my name is Felicia Velvet. I am an epidemiological analyst for Jefferson County Department of Health. I work in the disease control department. We do have other epi analysts on staff that work in quality improvement, if that's another area of work that you may be interested in. But my work is mainly related to disease control. I've been in this role for roughly about 4 years. But a little background before I got there, I have a background in biology, undergraduate degree in biology, and then I actually came here to UAB. So I am a School of Public Health graduate. My concentration was actually health behavior. And from there, I started an internship at JCDH in the prevention and epidemiology program, and utilizing my health behavior aspect, because you'll hear about the health education that they do through their jobs and their positions. From there, I got obviously introduced to epidemiology and the day-to-day work. In my current role, I work more so with the data side of things. And I would say my little slide up there, when Melissa asks, create a little slide about what you do. So I would say my work kind of falls into 2 categories. So data surveillance and monitoring, and special projects and collaborations. So for data surveillance, what falls under there are things like influenza-like illness surveillance. So when you hear about a percentage of ILI or influenza-like illness amongst our outpatients in the county, those are numbers that I report on and make that information available up to my direct line. So director of disease control and the health officer. These are things that go into decision making and reviewing. Also surveillance for COVID, obviously, which came on the scene, and in general emerging diseases, right? So since I've been in this position, COVID is one of the things that came about that we needed surveillance for. So that's also something I produce on a weekly basis at this point. It was daily when we were in the thick of it, as far as having meetings and making sure my numbers are up to date, stats are up to date, and the decision making that we have to do as a health department when it comes to the residents here in Jefferson County. Monitoring. One of my main monitoring duties are things with vaccination distribution. So, a while back we had concern for monkeypox. So looking at the demographics of the people that we are distributing our vaccines to, right? Making sure that we're doing right by our citizens, our residents, by distributing things fairly. Are we getting the word out? Are we only getting one type of demographic who are coming to receive our vaccines? I did the same thing for hepatitis A. So those are some things, projects, collaborations. Those are things that, come about as we go at the health department. So the data surveillance is kind of more of my day-to-day duties, my regular duties, and I do enjoy the special projects. One that I've recently been on is with, we had a collaboration with Harvard Medical, a team from there, and trying to implement in our sexual health clinic, making sure that we're really targeting our at-risk patients, our most at-risk patients who are contracting HIV, and making sure that we're getting PrEP education. Are you all familiar with PrEP? Pre-exposure prophylaxis, post. So making sure that education is getting to the people who really need it, and might need also that medication to possibly prevent them from contracting HIV in the next 2 years. So that was a project that I enjoyed. Also in this role with disease control, when we go into things like incident command, which is basically an organized way of saying, we have our layout for any emergency response. And I would be brought in more so on the data surveillance leg of that when we do have things like basically like COVID or monkeypox or things of that nature. So that's kind of how my day goes, or my weekly duties go. And then I put some tools up that I kind of use. I use a lot of data visualization. Between that, I do make them through Excel. I've used Power BI. That's a latest tool that I've been using over the past year. And then when it came to that Harvard project, I use R. I know you guys might use SAS or JMP. So R is a program that I was able to learn and use for that project.
Good afternoon, everyone. Thank you for coming. My name is Kayla Henderson. I'm a disease intervention specialist. I work in prevention and epi. Specifically, I work with vaccine preventable diseases. So that's going to be things like your varicella, hepatitis, pertussis, things like that. I've been at JCDH since April of 2022. Before then, I went to UA. I got a bachelor's in public health at UA. And like Melissa said, at first I was a biology major, then I switched over to public health. And when I switched to public health, I really didn't know what you could do besides working at the CDC. So yeah, then I came to UAB, got my master's, and while I was getting my master's, I learned about being a DIS. The concentration I did was epidemiology. And so at the same time, when I finished my master's, that's also when I started at JCDH, so it lined up pretty well. But like I said, a typical day for us, there are notifiable diseases in Alabama. And for certain conditions, when somebody tests positive, doctor's office, hospitals, they have to let us know. So we have a queue where when those patients test positive, we get like the lab results and things like that. So we're constantly monitoring that queue, make sure, we take care of everything that we need to take care of. And then once we get a notification about a positive lab, the first thing that we do is research the disease. We work with the same diseases basically every single day, but it's just really important before you start the investigation to make sure that you're up and ready. And then after that, you're going to reach out to the provider. We just try to get as much information available, see why the patient, came to the doctor or the hospital, what type of symptoms were they having, things like that. And then, like I said, the most important part is researching the diseases, because that's when after that, you're going to interview the patient. And it's very important when you interview the patient that you know that you have the info that you need to give the patient, the control measures, teach the patient how they can keep themselves from getting sick, how they can keep other people around them from getting sick, just educate them about the importance of vaccination for themselves and the people that they're around. And then, like I said, we interview the patient, and that's pretty much what we do on a day-to-day, just provide information about vaccine preventable diseases. And then it's not on a day-to-day thing, but often various organizations will reach out to us, and we'll go out to health fairs, which that is an example of one of the health fairs we did at JCDH. It was, we were providing information about hepatitis and the hepatitis vaccine. And like I said, we just go out to different health fairs, provide information about vaccines and just how to keep everyone safe. And thank you for coming. I appreciate it.
Good afternoon. Hi, I am Alondria Plump. I am a disease intervention specialist at the Jefferson County Department of Health. I've been at JCDH since 2006. 16 in an official capacity. As far as my educational background, I got my bachelor's in biology from Alabama A&M University in 2014. And then I graduated from UAB with my degree in health behavior, my MPH in health behavior in 2016. I started working at the health department like 3 months before I graduated. However, I have a very interesting story in my honest opinion. I started off working as a health inspector for the Jefferson County Department of Health. So I was the person that everybody was running from in the restaurants and things of that nature. I did that until my time expired in 2019. And I've been upstairs with prevention and EPI, working on the IDNO side of things. So that's your infectious diseases and outbreaks. So one of my favorite things to do is run my mouth and coming in on a day-to-day basis, I do get to, like Kayla stated, do interviews and interact with people in the public who have tested positive or had positive lab or reportable illnesses. But I also do like going out and doing outreach. And sometimes we have what I call outreach that's not necessarily expected. And we would call those things outbreaks. So those are at your daycares, your nursing homes, your schools, things of that nature, speaking to the administrators, following the appropriate channels, giving them control measures. In some cases, take my picture, yeah, taking specimen containers out. Sometimes you give them specimen containers and they don't put them in there properly. And then sometimes we have to go into a special room and transfer those specimens, be them likely stool specimens for the most part. However, it's a totally enjoyable job. You have to love what you do, but you are very well protecting the health of the county and of the residents of the county, making sure that they're aware from in an environmental standpoint, the risk that they run daily, with just doing the small things like washing our hands and covering your cough and things of that nature. Outbreaks range from anywhere like norovirus, which is a GI illness. Some are hand, foot, and mouth. Some are ILI, like Felicia stated, influenza-like illness. You never know what you're gonna get. Some days you're just at the desk doing your regular investigations, and other days by 9, 10 o'clock, you're getting specimen containers and you're headed to a daycare. To just basically inform the public on what they can best do to slow the spread of illness. Like, illness is out there, but there's no need to let it go rampant. I just love what I do, and I'm so excited that y'all allowed us to come and speak to y'all. And once again, thank you for coming to the Kayla Show.
Hello, my name is DeFellis Delano Dumas Sr. I've been working at JCDH 15 years. I have a bachelor's in biology and inside physiology from the University of Alabama, Huntsville, and I have a master's in ministry. And I started working at JCDH, and how I got started at JCDH is in 2008. If you notice, in 2008, we had a #1 disease, and that was in syphilis. And I started my work there in 2008, working with JCDH. So from 2008, I worked for SD clinic. Then I moved to prevention and epi. Then 4 years later, I moved to immunizations. And then 4 years later now, I'm in TB. And I'm going to tell you what we do in TB. And everybody knows what we do in TB because all y'all have skin tests. And you're going to continue to get skin tests as long as you're alive. So that is job security for me. Thank you. So what we do in TB, everybody says, oh, it's just one disease. Well, no, it's one disease, but it's one disease that is very complex because if you have preconditions like diabetes, or if you have blood pressure, then everything changes. And then we have people that are foreign-born that take BCG vaccines, and with BCG vaccines, everybody think they cover for the rest of their life. That is not true. Correct, Dr. Khan. Amen. All right. So so what we do is we go out and we collect sputums from hospitals, from patients who may have a positive T-spot or positive quantiferon, and we also do skin tests. We also go into the prisons and make sure that they are doing their skin test or their blood test to make sure, because it's a large population in small areas. We also work well with UAB in every aspect, even school public health, and even with all the doctors that come in, because everybody gets a skin test and everybody gets a blood test. And if the skin test and blood test come back positive, the first place they call is us. And we do chest x-rays in-house. And so we do give everybody a chest x-ray in-house, and we view chest x-rays and to make sure that you don't have active disease. Most of the time is LTBI, meaning that you have the bug, but it's not active. And y'all say, well, I thought TB was eradicated. Well, can I tell you why TB is not eradicated? It's because people come in and say, I don't want to take the medicine for LTBI. I don't want to take it. I'm young, I'm healthy, I don't want it. Well, they get 50, 60, or may have some other illness. And guess what? TB shows up. And when it shows up, then it comes rapid in your body. And so TB is not just only in your lungs, but we have several cases where somebody had TB in their hand, TB in their knee, TB in their spine. We have now a patient where they have TB in their liver because they had a liver transplant and they found out that it was actually TB in the liver. So it's just not just in the lungs, it's just not in a respiratory. TB can be found anywhere in the body.
Hello, everyone. My name is Brittany Reynolds. I am a disease intervention specialist. I work specifically with sexually transmitted infections. Yay. I've been at the health department for roughly 2.5 years. I have a bachelor's in community health and human services, previously known as health education. I have a minor in public health, and I also have my master's in community health and human services. So I actually started off specifically working with HIV. I worked at a local HIV clinic here as a linkage and retention coordinator for about 5 years. So I was always on the treatment side. And so I thought it would be interesting to see things from a preventative side. So a day-to-day role for me, it depends on the day. We have clinical responsibilities, and we also have field investigation cases. So on a clinic day, we offer something called fast track screening. So that's basically someone who is asymptomatic, who's not experiencing any signs and symptoms of a sexually transmitted infection. They can come in and they'll see someone like myself. I'll do all of their screening for them. So we are trained to draw their blood, so we get certified in phlebotomy. We also collect their urine specimens. We spin down viral loads, things of that nature. And then we contact those individuals back to notify them on their test results. This picture is an example of us drawing blood in the field. So sometimes we do have patients who don't want to come in because unfortunately there's still stigma attached to the health department in regards to sexually transmitted infections. So we don't want to be a barrier to getting individuals tested. So we'll go out to their homes. We'll meet them in the park. If we have to draw blood in the car, we'll do so, just to make sure we're meeting the patient's need. Also in clinic, we have a PrEP and a PEP clinic. I'm the PrEP and PEP navigator. PEP is post-exposure prophylaxis, and it's medication that's provided. You have a 72-hour window period to take that medication for 28 days to reduce your chances of becoming HIV positive. So I help patients navigate through that process and what they may look like. We also have a PrEP clinic, which is pre-exposure prophylaxis, and it's medication that you take daily, once a day, to reduce your chances of becoming HIV positive. On a field investigation side, outside of drawing blood for different infections, syphilis and HIV specifically from outside providers and also from JCDH, we have to notify individuals about either their exposure or if they have a positive lab result. And the goal is to get those individuals in, provide treatment for them, and to conduct an interview. So for our interviews, what that may look like is eliciting partner information so that we may notify that partner that they've been exposed and to get them in as well. I think that is a visual for the bulk of the things that we do. Syphilis is on the rise again. We might soon be in a syphilis epidemic. So a lot of our focus has been focusing on syphilis and congenital syphilis as well. Thank you.
So, my name is Devin Sims, and I'm the Disease Program Manager for Prevention and Epidemiology. And I'm kind of wrapping up this panel discussion, and we'll open it up for questions. But just a little bit about myself. Like I said, I'm the Manager for Prevention and Epidemiology, and we are responsible for the surveillance and the follow-up and the coordination of the notifiable diseases that include vaccine preventable and non-vaccine preventable, except for sexually transmitted diseases and tuberculosis. I received my bachelor's from Tufts University in community health and political science. And then I came to the School of Public Health here, and I got my master's in epidemiology and international health. So a little local news there. So though we have epidemiological analysts here with us today and also disease intervention specialists, there are a variety of public health careers at Jefferson County Department of Public Health. And this is just a list of a few of it here. There's even more. But I just want to give you an opportunity to see that there are other things besides what you see here. And getting a position at the Jefferson County Department of Public Health kind of has a few layers to it. So I just want to explain that to you all. And you should have gotten one of these career pamphlets if you're interested. It's got a cute little QR code that you can scan and go directly to jobsquest.org. And that's where we recommend you go first if you're interested in working with us. So going to jobsquest.org is where you can go in and set up a job alert. And so setting up a job alert is a great idea because that will let you, put in some keywords and you'll get an email right to your email of when those particular positions and keywords are available. And then you can go in to apply to those open positions. And then once you apply to those open positions, that goes to what we call the Personnel Board of Jefferson County. Because we are a government agency, we are a part of the civil service along with many of the municipalities in this county and other service agencies. And so you get on the list at the Personnel Board. They are the human resource arm for our county, and they sift through those applications. And then once they sift through those applications and filter, you are on a list. So once you achieve that particular step, you might be on the list to be a disease intervention specialist or an epidemiological analyst or a public health engineer. And so once that happens and you're on the list and that agency is ready to fill that position, then they will send you an email and say, now it's time for you to apply directly to the Jefferson County Department of Health for that particular position. And then at that point, you can accept to reapply directly to JCDH or whatever municipality has that particular position open. Then you can accept an invitation to interview if you receive that, and then accept a job offer. So a few layers that I'm not sure everyone is aware of in regards to the civil service here in Jefferson County, that Jefferson County Department of Health is associated and a member of.
Do you all have any questions for any of the panelists or for all of the panelists? Let me just recap for those who are on Zoom and may not have heard the question. So the question was specifically for the UAB School of Public Health alumni. What courses help prepare you for this role? And then what course do you wish you had taken, or what courses do you wish you had taken to kind of help prepare you for this role? So I'll pass the mic back down.
One course that really helped, it was an elective, but medical terminology. Because like I said, when we talk to the providers and we review the medical records, it's a lot of things, like the nephro and then all the words that pertain to things in the human body. So I feel like that helped a lot. It makes it easier to read the medical records so I don't have to Google every single thing. And yeah, I think that was a really great class.
I think I should have taken that class. I didn't know it existed. But for me, a class that I wish I had taken because I was in health behavior concentration would have possibly been like a form of psychology. Just because as you apply for jobs post-graduation, a lot of jobs are looking for that background. And I'm like Kayla, when I was here, I was just wondering, However, in being a health inspector, you encounter so many different people on a day-to-day basis, whatever they're going through, the way they understand things, the way you can relate concepts to them. I feel like that would have been extremely helpful. And just getting practical advice for handling people and getting information across. I think in any profession that would be useful information, but especially in being out in the field and dealing with people of different nationalities, different ethnicities, different religious backgrounds and cultural backgrounds as well. Going into certain establishments, and because you're a woman, being treated differently, or being asked to speak to the wife and not speak to the husband directly. I think all of that information it would have been helpful to have some type of background information in regards to that. Anybody else?
Well, still ask everybody, because I mean, we all kind of have a different background, but just whatever classes maybe prepared you for this role, or classes that you wish you had taken.
Well, one class for me, it's an elective and it's under Community Health and Human Services, was motivational interviewing. And I've noticed that when I'm conducting those interviews and eliciting that partner information can be really, really difficult oftentimes because they don't want to be there. And now we're asking them, very sensitive information. So being able to elicit that information and still glide that patient through making a behavioral change, I think that class is beneficial to me.
Yeah, I'll definitely just piggyback on that. A lot of the data analysis and epidemiology courses were definitely useful, but a lot of our work also is about the interviewing and the health education. And so I do love motivational interviewing and courses that help you to critically think and probe for more information in a way that does not anger a patient, does not upset a patient or ruin your rapport with the patient, is definitely useful for on-the-job experience.
My education, so as far as public health, I did a health behavior track. So I would definitely go back, and reverse engineer, getting more of the epidemiology courses, overall. I definitely appreciated getting the on-the-job experience. So yeah, I would probably go back and do more technical courses in epidemiology, but where I should go as well. It goes either way, but I would have liked those courses as well.
For everyone on Zoom, the question, it was speaking about the timeline and just the process of getting hired, I believe. So the timeline, like I said, I was in the master's program here. I graduated in April of 2022. But I applied with JCDH in October of 2021 because, the end of school was coming and I needed to do something. So I applied in October of 2021, and then I got an email setting up an interview in January of 2022. And then I did my interview in February of 2022. And then I got hired in April. So it was a process, it was a little disheartening, but it all worked out. And so I would encourage, it may take a while, but you should still do it.
So I'm gonna go a little detail in the process so you know exactly. So you go to jobquest.org, and so the personnel board actually makes a list. And so what takes time is if you don't qualify, then they have to notify each person why you don't qualify, and then you have a time to rebuttal. So they may have missed something in your transcript or something that they may have missed, or your transcript probably didn't get uploaded. So during that time, it's a process, because some people will get and say, hey, congratulations, you have did everything else, just wait for the health department to call you. Well, so that's a process before we even get your name. They're doing that. So when the health department gets your name, then they will send you an actual email, say, hey, you made the minimum qualifications. So now do you still want to apply for the position? So let me just make sure so you be very clear. I work in TB. So you may apply for DIS, but then they're going to send you saying, hey, there's a position in TB. Do you want that position? Okay, just say P&E. If P&E have a position, it's going to say, hey, there's a position in P&E. So just because you applied for a DIS doesn't mean you're going to be on all the lists. They're going to send it to you each time there's a opening. to say, hey, because you might not want to work in TB, you might want to work in STD. So each time they will send you a email saying there's a position open in this area. Now, if you do not apply for TB or STD, then from the health department, you would not be on the list. Even though you applied through JobQuest.org, it's the way of health department making sure that we're streamlining that this is what you want to do. And so, but what I suggest is apply to all of them. Apply to TB, apply to P&E, apply to every one of them, you know, but each time there's an opening, because you're going to say, well, I did this already. And they should have my application. I did this. No, you got to go back and do it again, because that was just for this program manager. And that goes to this program manager. That goes to that program manager. So it's each time that it goes is a time. So that is kind of a process. But I can tell you, once it gets to the health department, it moves faster. Okay. But until we get the names from the personnel board, then once we get to the health department, then it moves faster and it's a faster process. Because they give you a week to do the application from our system. They give you 7 days to do the application, and then they'll pull a list from there to go to the hiring manager.
So I'm going to speak from a space of vulnerability and transparency. Initially, when I applied in 2020, December of 2020, I made it all the way through the interview process and I did not get the job. I was devastated. However, the next time the opportunity presented itself, I reapplied. And maybe a week after I graduated with my master's, I got the call and said that I received that position. So with that being said, if you do not get it the first time, do not get discouraged, use that as motivation and reapply. You know, that's giving them, you know, the ideal of this person really wants it, or because you have to be passionate to do what we do. There has to be some passion behind it. So if you don't get it the first time, it's okay. If this is something that you're passionate about, keep trying and it will work out.
And just to clarify, when you apply through the personnel board, you apply there once. Your name stays on the list for at least a year, but then you are invited to reapply to the health department. And if you apply and that round of interviews goes forth, they, you know, offer the position to someone else, and then another program wants a DIS, then you would reapply to the health department, but not to the personnel board. And just to speak to your question about training and people
experience that you might come in the door with, realizing that some students may have a few different internship opportunities under their belts. Others may feel inadequate even to put themselves out there for the job that they really want. You know, would you encourage them to get a little bit more experience in internships, or would you say, no, go for it because we have needs, you know, that even that minimal experience, you know, would be suitable for?
Yeah, I think both things can be true. So getting the internship experience while you're in school is definitely a plus. That is something that, you know, any hiring manager would love, but that doesn't negate you from being in the running for the position. There may be other things in your resume or in your experience that we're looking for, and it just depends on what the need is in that area. But get as much experience as you can, but don't let that be a hindrance to you applying, because this could be the opportunity for you to get that experience.
I want to say I agree with everyone. And I'm gonna be transparent like Brittany. I started at the health department in 2015 as an intern for the summer pools. I was previously a lifeguard in the city of Birmingham, so I was familiar with water chemistry, things of that nature. So it was not as many hours in the sun and it paid a lot better. And I was, you know, getting my foot in the door at the health department. I did that for the summer of 2015, and in the fall semester of 2015, while I was enrolled here, I got asked if I wanted to become an intern with prevention and epi. So sadly, there weren't any openings when I needed a job. So then I had to go downstairs where I did not have any experience, but I was trained to do my job. So I do encourage you to get all the experience that you can. But like Devin said, two things can be true at once. And it resurfaced when I went back upstairs in 2019. I hadn't been up there in 3.5, 4 years, but those skills, those gifts, those talents still showed up on the job. And in regards to the application process, I can say that I did get the email stating that something was incomplete, and I couldn't quite understand that. But pay attention to your emails. Please check your emails. Please check your emails. Please check your emails. Because I almost did it. I almost missed it. It was the last day for me to plead my case to the personnel board. And I was downstairs and I was the health inspector, and I loved what I did. I just wanted people to be more receptive to me. I wanted people to see me as an ally, and I felt like I could do more of that upstairs. And I literally had to send them my undergrad transcript, but I was like, you have my graduate school transcript, but it was something as small as that. And it really went down to the wire. So I encourage, when you put an application in, there's nothing wrong with calling and checking on your application, checking the status, checking your spam folder, checking and being very attentive. Because I mean, we all want to get out there and get our feet wet and do the work that it is that we come out here to do. But check those emails and be consistent, because I literally had to.
And I'll just add real quick, like, pretty much a lot of people here have already demonstrated how you can move within the health department. And I just want to say, from the data side, we've had many people who have also transitioned into management information systems, MIS. So if you're thinking about epidemiology from the data side of things, there's, more than what you see here today. Like, there's a whole nother side to us where you can get into the data side. And use that side if that's your interest as well.
So the question was, do we prefer MPH or MSPH? And we don't have a preference. We're looking at what the interests are of the applicant, what their experience is, and if what the job has them doing, it fits with their motivation, and if they will be happy in that.
It's also what they majored in, FE or health behavior or whatever.
It really depends on the hiring manager. We love all the concentrations, but epidemiology, that's a great concentration to have. But as you can see, we have health promotion, health behavior up here, and we have some other concentrations. So having an epidemiology background is awesome, but that doesn't mean that that's the only background or the only concentration that we will hire, whether that be in prevention epidemiology or STD or tuberculosis.
The question was basically, do we work with other departments in the health department? We do.
There are definitely opportunities, and what that takes is just reaching out to us, and what we have to come up with is a data agreement on what we can share. And so yeah, so the possibilities are endless as long as we can, obviously be mindful of HIPAA and things like that.
The skills that are highly valued at the health department, hard and soft skills, the ability to be able to talk with people, to be able to quickly build rapport, be able to respect and be able to talk with people in a non-judgmental manner. Those are some of the highest skills, because a lot of the other skills can be taught, can be trained. Critical thinking, data analysis, being able to follow instructions, read. That sounds simple, but be able to just closely read through medical documents. And so just attention to detail, the ability to be able to do things as simple as, risk ratios, odds ratios, things of that nature. Look at incidents, prevalence. Those are all things we do. Epi curves on some days and things like that. So the hard and the soft skills are things that we are looking for.
Non-judgmental. So in TV, we actually go to people's homes every day. So you don't, like I tell everybody, I'm at your house. So whatever you're doing at your house, that's what you're doing. My job is to make sure you get this medicine every day. So we look for people who's non-judgmental, who can go out and are kind of like go-getters, because most of the patients that we receive are sick. They're coming from a hospital, they have active tuberculosis, and they're sick, and so you need someone that actually have, kind of care, and enjoy what they're doing. So yes, non-judgmental.
One word, being compassionate. sometimes we do have to give life-changing diagnosis such as HIV. So having some compassion behind that when you're disclosing that diagnosis to someone.
I'd like to add flexibility just because your work roles like can change in an instant. I think COVID showed all of us that even as students, as professionals, being flexible and adapting to situations and making sure that you're consistently seeking out information, because in the field of public health, information changes so rapidly. Like I was leaving church yesterday and somebody was like, oh, at a former job, a job I used to have, she was like, so what's the COVID protocol now? I have some girls who tested positive and X, Y, and Z. So just making sure that you stay abreast and just making sure that you're flexible and able to answer questions. And if you don't know, finding out and making sure that you are a good communicator. Written communication and verbal communication, I think, is imperative.
One skill I would like to add, it's kind of basic, but time management. The investigations that we do, we have to turn them into the state within a certain time period. And so the time management can be pretty important, especially if you have multiple investigations. You have to, if you're not able to reach the patient on the first time, you have to call them multiple times, send them a letter. So you just really have to try to get the investigation done in a timely manner. And you just have to be able to manage, you know, like I said, if you have a lot of investigations, then you just have to be able to manage them. I think that's really important.
And I would add self-motivation, because I know a lot of people's jobs here, deal with being out in the field. So nobody's, looking over your shoulder. We also, it's different for different departments, but, we also have work from home time as well. So during that time, you have to be able to keep on task and make sure you're staying up to date when you're also working from home.
The last word that I just wanted to use was curious. Curiosity is very important to what we do, and not always taking things on face value, but probing and digging and trying to find out connections.
Yes, sir.
One more question. I'm teaching epi methods right now, and I have 29 students, 2/3 are international students. A lot of them have a medical degree from their country or a dental degree from their country. They're getting an MPH or an MSPH. And many of them want a part-time job. And these are very bright people. I don't know all of them real well. It's only the second week of class. Is there any mechanism, I guess maybe a broader question, if you needed, collectively, if you needed help right away, there's an epidemic or there's something going on, is there any way to hire part-time people, these people I have in mind, or anyone else? Or is it they want like a part-time job, like 10 hours a week or something like that? Is there any way to do that if you wanted to do?
So there probably are channels going through our human resources department if there was the need. So for example, when we had COVID going on, we had a need for contact tracers. What we ended up doing was going through a staffing agency, but I know in the past we have used interns from SelfMotivation for large scale projects. So that's something that our medical director and our HR department could put something together in regards to doing that. Currently, our intern positions come out whenever they're needed. So for example, there's one intern position open right now in our health equity and population health department, but there would have to be a specific need for a ramp up of something like that.